Yeah.
How do you prevent yourself from regressing back to the white box? Because that's a place of confidence and comfort and rules based, and you feel really good, you know what you're going to do. And the step box may be paradise and hell, and I've been there.
Yeah.
But some days it's more hell than paradise.
Yes.
How do you, what keeps you in the right boxes when your goal is as aspirational as this group's goal is, which is to really impact the health, mental health of kids, which is hugely important.
Yeah, I mean, I think this will sort of run a little bit counter to everything I just said. I think of structure, which is I think there are certain structures that you can build into the operation that are forcing functions. I mean, I guess this is systems improvement 101, but that every day, the way my day is structured, if I'm running one of these initiatives, is that I huddle in the morning at 8 o'clock in the morning, and I huddle again at 5 o'clock at the end of the day with people. We're assessing our progress. We're using those times to revisit our values. We're telling stories of success. We're telling stories of failure. We're leaning on each other, and we're supporting each other. Every week, we're looking at data on our progress together, and that data is a source of analysis. What you see is people are rabid for these data where they're doing this successfully. I was in rural Honduras last spring, and I walked into a clinic, and Uma, you would have loved this. There were run charts and control charts just plastering the walls, and I said to the people there, tell me about this. What is this that you're working on? And they said, oh, this is our improvement work. Every week we get new data from the ministry, and we bring new ideas about how to get things better. And it's almost, I said, how do you find it? And the word they used was divertido, fun. It was actually their sort of fun session of the week, and yet they were saving lives in the process of doing it. So I think facing into the data and not being afraid of it and not being afraid of the pain that it might cause that's another sort of operational thing or structural thing that can be done as well. So, and I think there are probably other forcing functions like that. It is a values thing at the end of the day, operational values, and I think that's the job of leadership at some level is, I'm giving you these operational values, not general values like be nice, but operational values like, this is how we're going to respond to customers, and that's going to guide decision making so that people can constantly refer back to that. Yeah.
There have been some...
Come to the Richard.
There have been some big initiatives in the U.S. that are heartfelt, have all of the positive emotional sides to them, and were dismal failures. I'll give an example. DARE. Do I dare say that? And the people who were promoting that and the officers in the schools and so on felt like they were doing very important work. So how do you reconcile that?
Yeah, I think it happens often, and it's the balance between the emotion and the day-to-day facing into the data, that rhythm that I referred to, that rhythm of work. You can have all that emotion, but if you look at the data every week and it's clear that the needle isn't moving, you can kind of fudge it for a couple of months, but then people say, hey, wait a second, this isn't yielding what we are kind of promising. So I think the habit of continually referencing and re-referencing progress is sort of crucially important. And also reverence for logistics. One of my favorite little aphorisms is from the Army. It's amateurs discuss strategy, professionals discuss logistics. If you have an organization that really reveres logistics, you can tell because they pay the logistics people in the same way that they pay the strategic people. Project managers are respected. Data people are respected. So I think that's a very concrete way to create that culture. It's a balance. It's a balancing act.
Dick's both. Just to be clear, even though I'm on this side of the room, I'm not Brian. Let's get that straight. I hope we all fail. That's a quote from a speech my son gave at graduation, high school graduation. And I really kind of liked it. And I was noting how yesterday I was thinking about all the modal terms we were talking about, capacity building and infrastructure. Today, I've heard that word a lot more. And I think that's really good because we have so much that we can learn from failure. And one of the things I sort of intimated was how at the systems level in our work, we have more latitude for allowing for failure, and if it has fueled some of the innovation, have solved some of our problems at the program level. That's a segue to, you're speaking more about this idea of safe containers for failure, because I'm kind of intrigued with that whole idea and how we might benefit from it here, how we can kind of learn from our failures in a better kind of way.
Yeah, it's another leadership job. I think that's it's hard. There is a sort of a vigilance about applauding people who are able to talk about failure, and also encouraging those who are afraid to share it. But it's hard work. Again, I worked for Don Berwick for 10 years. The first 5 years I worked for him, I was basically a product of my training, and my training was, if you don't know the answer or you think you have the wrong answer, don't speak. And I can remember very vividly being in a meeting with him, and he said, just say something. Try something here. Tell me what your hypothesis is. And I told him my hypothesis. And he said, that's wrong, I think, but let's test it. So it's. I think that's that like deliberateness to managing, but it can be imparted too if you have these explicit aims and you have these time frames of review of data. It's people gradually begin to understand. Oh, wait a second. This is what we're doing. I wouldn't teach quality improvement, by the way, in all cases. That's my training. To the degree I have training is in quality improvement, but I don't think you need to. Teach quality improvement all the time in a didactic way. If you just tell people we have an aim and we have a run chart and we're going to be testing new ideas to improve our performance on this run chart week in and week out, that's kind of the essence of improvement. So, I do think there's another potential pitfall is maybe over-teaching the scientific side of improvement as opposed to just getting people out to get started. And people will sort of at first say, whoa, we're going too fast, you're pushing us too fast, but actually you sort of have to say this is the way it's supposed to feel, I think.
I'll defer to Tom.
I'll be brief. I think we're all on the same theme. I'm resonating to the failure issue. Not so much to put you on the spot, but to think out loud as a field. Part of our paradox as prevention scientists is that we get funded to show that we've developed an intervention that works. So we're not highly reinforced for publishing or showing that an intervention didn't work.
Yep.
And in fact, punished pretty heavily. That could have severe career consequences. And I think reflecting on our field, at a certain point, we need to lose that paradigm and start when we fail to have an effect in one implementation versus another, get that out there, get the word out there so that others can benefit and do a better job of specifying the conditions under which we succeed or fail, rather than just simply dichotomizing the field as success or failure. So.
Yeah, I really think there's no failure. There's just learning, And if that were the approach that we took, then any paper you wrote to summarize a study would say, here's what we learned. We learned that this didn't work, but here are the promising components of it. And that's why I also think, moving from kind of binary study designs to study designs that are more nuanced and look at the texture of what's happening in different environments and different settings maybe sets researchers free a little bit too. The other place where I think there's a limit is that researchers aren't typically funded in the same way to do implementation and to do dissemination. So breakthroughs are more valuable than successful implementation. But there are some systems, I don't know if this is true at Cincinnati, probably is, but I think it's true at Johns Hopkins, where they're beginning to look at giving equal points in the academic advancement system for running successful implementation or scaling projects as you would get for publication in I don't know if it's a top tier journal, but certainly a pretty good journal. And so those are meaningful incentives, I think, to look at. Thanks, yeah, thank you.